Hi Jithu.
Hi, ma'am.
It's been a while since I really wanted to, do a podcast with you,
Oh,
and you've been one of my favorite fellows as well, and
thank you so much.
yeah, and I've always enjoyed having any kind of conversation with you. Be it over a coffee or in the canteen. I
True.
really miss all the conversations that we
Yeah,
used to have when you were working with us at Rela Hospital, and
yeah, ma'am.
I must say we do miss you right
Thank you.
now. So
But I do.
you left the nest, and you are coming up as an upcoming or an emerging interventional radiologist in Kerala, and I'm very proud of you for what you are and right now. So, so Jithu, for the sake of the audience, I know all about you, so you don't have to introduce yourself to me at all. But just for the sake of the audience, just tell them what inspired you into interventional radiology, or how you landed in interventional radiology. Where did you do your medical school, and what inspired you to get into IR?
Well, thank you, ma'am. Thank you for that good words. And I too miss Rela Hospital and your team. Ma'am, I did my MBBS from Pondicherry. After that, I came back to Kerala. I worked in CMC Vellore for 3 years, where I did develop my skills. That time, I had no clue that I'll be going for radiology or interventional radiology. But after working in CMC Vellore Medical ICU for 3 years, I came to know that I got developed some skills where we can have a lot of confidence and decision making skills and a lot of other things. So after working in CMC Vellore, then I came back to Kerala, did my MD from Trivandrum. Then while working, after my completing my MD in radiology, I worked in a private hospital, corporate hospital in Trivandrum, where I found a person who runs around and deals with patients. So that time I realized, okay, who is he? So chill, cool, but he's busy as well. Then I met him, I went and asked him. Then he said, like, I'm an interventional radiologist in that hospital. So I was so surprised to hear, okay, intervention radiology, which is again beyond the
Yeah.
diagnostic part. So there I realized, like, where radiology ends, there starts the intervention radiology,
Yeah.
which means like we will sit and diagnose certain diseases. That's all. Radiologist work is done. But intervention radiology starts from that point. Where we stop, from there, intervention radiology starts.
Wow. Yeah.
And also, its hands skills matters, but the mind, the decision making scenarios, decision making skills, and the knowledge in clinical medicine, how to deal with the patients, all those things club together forms intervention radiology. So I developed a small interest in that, and I started doing. But then only I realized, like, all the procedures, even if it's a small drainage procedures to biopsies to high profile cath lab cases, all comes under intervention radiology. So I haven't got any of the specialty training during my clinical radiology training
Uh-huh.
over the 3 years. But later on, after getting all this information, I started searching for the further studies.
Yeah.
There, I got to come to know about your hospital and the team. I applied and cracked the interview. Out of 32 candidates, I got that opportunity to
Brilliant.
break
Yes.
that and come to your
Yeah.
world, your nest, where you trained me over 2 years of dedicated training in intervention radiology, and here I am now. I am working as a consultant
Yeah.
in Baby Memorial Hospital, Calicut.
Yeah. Well, all that I can say is, again, once again, I'm very proud of you, and I'm so glad that you have chosen this specialty. Otherwise, I wouldn't be here talking to you,
Oh,
and I wouldn't have known you in my life. So it's very few people who we come across as real gems or real pearls in your life, and I think you are definitely one of those pearls in my life,
thank
and
you,
I'm
ma'am.
glad you have taken IR
Thank you so
specialty.
much.
So just going back to your training, this is just for the sake of the trainees who are actually, the interventional radiology fellows. When you start your training, was there any point wherein you felt, I'm not cracking it, or I'm not getting it right? I don't know if I've chosen the right specialty, because all of us, we go through phases. This is
True.
what I tell, the current fellows as well. Don't get disappointed or don't get disheartened in the initial 6 months, of your career as an intervention,
True.
as an IR fellow. There may be phases wherein there would have been a complication, there would have been something, we would have messed up a case. What is that one piece of advice that you would want to tell youngsters when they face a situation like that? Have you faced it? That is number one thing. If you had faced it, how you sailed through it is something that I want to hear from you.
Yeah, ma'am. Very true. Because this is a very new specialty for people who come just finishes a radiology and come to a different world. So when we see such people who are pioneers like you might have gone through a lot of pain and complications, and you have seen a lot of things. So when I joined, I haven't had any clear picture how I will complete this thing, because initial phase was very difficult, and not only the skills part, the trying to understand what are the wires, catheters, radiology one side, clinical things, because for the past 3 to 4 years, no touching with clinical medicine or radiology, sorry, clinical medicine, and dealing with the physicians, referring physicians. Here we work as a clinical physician. We will be dealing with referrals. We will be talking with the consultants, referring physicians. We will be knowing about the patients. We will be dealing with the patients, and we will be seeing their files in details, all the blood values, all the normal, abnormal values, which we have never got any training from the radiology. So initial phase was really tough, and the workload is really good. That matters, because when we get a training from an institute, we should have proper volume of cases, and of course the mentors. We should choose the mentors wisely, and I'm glad and I'm proud that I have got that opportunity, because even if today till day when I look back, one person recognized me as, yeah, you're Dr. Deepashree's fellow, right? Even today. So I'm proud of that
Oh well, I'm
situations.
humbled by that. I think we are
Ma'am,
praising each other here,
no,
and
no,
I'm
ma'am.
truly
And
humbled by
as you
that.
know
Yeah.
well, I am the only fellow who have made lot of complications during that 2 years,
No, but
and
then you, yeah,
I
yeah, you
learned
learned.
from each
Yes,
complications. I learned a lot of things: how to tackle the situations, how to handle the patients, how to handle the family who have undergone that situations. It's
yes,
not purposefully we are making such complications, it's
yes,
certain, because when we treat 10 patients, 10 patients responds 10 different ways,
correct. Yeah,
where we will have no clue. It's not written in the textbooks when you have to treat in this patient such a way that it's all different, and each case is different. For me, when I was a fellow, I was seeing each case as a new thing.
yeah,
I have that curiosity, what is happening, why this is happening. And even some certain point I came to a decision like, should I continue this, because that much hard work and pain, stress, mental stress. But later on, once we finish all these things, when we see the patients responding so well, when the family comes and show their love to us,
yeah.
everything is clear.
Very nice. Yeah,
Every single moment what we have shattered, or we have shed our tears or pain or sweat, whatever it is, it's cleared,
yeah,
because the family is so grateful, they're so happy, because they have overcome that big scenario or situations where
yeah.
we have saved them from a major surgery, anesthesia complications, lot of things. But yes, it's true, and complications we have to always, each and every case we have to see, and we have to imagine what if. We should have a proper backup plan. The worst scenario of the case, what will be the backup plan? And mentors like, ma'am, you had such a great patience, because I have made a lot of complications, even not only in adults but as well as in pediatric cases. We have seen, and I don't know how do I overcome those days.
Yeah.
But when I look back, I used to train to my junior radiology DNB registrars. I used to tell them, you will go through such complications in life,
Yes.
and you should have that calm mind. You should not be panic. It will be panic situation, but you should be so calm, cool, just pray and deal that situation. Be humble.
Yes,
Be humble.
which you did, and I think it's important. I mean, I think all the points are very nicely taken, Jithu. I mean, I think you're telling from the heart, and
I don't know.
I can, yeah, you're speaking from the heart, and I truly understand each and every word that you have spoken. And one more important thing that you have brightly said is, we as interventional radiologists, we are also clinicians.
True.
interventional radiology is not just about doing some kind of a technical job.
It's
Uh,
beyond procedures.
exactly, it's beyond procedures, and I think it's very important for every radiologist to have that clinical acumen to understand what a clinician is asking us. And if we can have an understanding of a clinical knowledge, we can make the best interventional radiologists in the
True.
country. So, and I think you rightly pointed that out, and it's very important for us to understand that. Now, moving on, so now you finished your fellowship, you had your initial struggles, you had your journey, and then you went over that, and now, you've decided to come to Kerala, and now you wanted to establish yourself as an independent intervention radiologist running your own setup. So, how was the journey like? When you wanted to, what made you choose? There are different options, right? You can work in a corporate hospital, you can work in a government medical college, you can think of an independent setup. What made you choose this particular specialty? What was the idea behind, not this specialty, this particular setup or the center that you're working?
Why? Because I have done a hospital shopping from South Kerala till North Kerala.
Right.
But when I came to Calicut, I realized that there are a lot of need of doctors with intervention facilities very less in place like North
Uh-huh.
Malabar, Kerala.
Okay.
So there I got, my uncle got gave me an opportunity to start up the department. So I started the department from the scratch.
Wow. Okay.
So I had an idea like I should develop a department where I should bring something new,
Yeah.
where others doesn't have some secret essence. So I started my first OPD in Jan 2023. I still remember there are no patients. OP is zero because most of the senior most consultants are in the town, they have no clue what is intervention radiology and they don't refer patients to me. But gradually I made a clinical meeting or clinical presentations during the MDT tumor board and the Wednesday clinical class where people realize, okay, there are options where surgeons stuck get stuck. There comes intervention radiology. So I have made a good presentation where people came to know it's an awareness program kind of thing. So they were so happy and they started sending me patients. Gradually from zero I started getting 1-2 patients, and I'm proud and I'm happy to share that now in per month I used to see 85 patients,
Wow.
and from that 85 patients I used to get converted procedures to 65 to 70,
Wow.
including all the
Incredible.
modalities.
Amazing.
So I'm happy, and it's a great thing. I should tell, like, developing this skill, and I have a good rapport with all the clinical physicians.
Yeah.
So they used to send me patients. I used to get back to them and tell them
Yeah.
how's the response and
Yeah.
all the feedbacks. So
Yeah.
they will also have a, okay, he's calling me up and taking up the call when they are in need. I am there to always available.
Yeah.
So we should, first thing, we should be able to give our time. We should be available. Second thing, we should take that risk and challenges, because I am the only person and I have seen a lot of cases what ma'am have taught us, but I have started while practicing. It's a different scenario, different
Yes.
world.
Yes.
Not only the cases I have got trained, I started using or doing the cases, which is very new to me.
Correct.
So each and every time I used to call you up, ma'am, this is the case, what should I do? Then you used to give me a boost. You have the skill, do it, finish it off. Use different catheters. There I started using different catheters, guide wires, different techniques. I started reading. And also I got opportunity to attend many conferences, national as well as international conferences, and present papers. There I learned small things. It's a slow growing, but I'm happy.
Yes.
And stay contentful, humble and happy that each challenges when you face,
Yeah.
be strong enough to handle that complications and handle any situations.
Yeah.
So yeah, that's a, I don't know how to explain in detail, but
No, but I think that's very insightful, and I think you have shared a lot of things here. What I like about this, or like about you rather, is you've always been that people-friendly person, and you've always been someone with very good interpersonal skills. Like right from your fellowship days, I've been looking at
yeah,
you, and I think it is very important for radiologists to have rapport with our colleagues, right? Which we as radiologists, if we confine ourselves to one dark room or, stay in the cath lab
Dim light
and
with
yeah, exactly.
computers and coffee. That's
Exactly,
all.
and probably some music on. So, if we don't have rapport, if we don't attend the clinical meetings, if we don't call them up, if we don't do that, we cannot grow in our
True.
practice. And I think this is very important for all the youngsters who are trying to come up right now, who are trying to work either in a corporate hospital or any other place, is to have that rapport, and collaboration is the key.
Yeah,
And I
true.
think you have the talent, and that talent has definitely brought you so far. And I think you are hardworking as well.
Yeah.
And again, this is something that I would want to tell all the youngsters who are watching this podcast today, that it's important that we invest our time and energy in it, at least in the initial days, and which Dr. Jithu has done. And attending the national conferences, international conferences, scientific meetings, having your MDT discussions, attending the clinico-radiological meetings, the tumor boards, making your presence felt.
Felt.
All that is so important, and I think you have done a phenomenal job at that.
Yeah.
So, right now, are you happy?
Yeah, I'm extremely happy.
Yeah.
And
Okay.
I'm so contentful that like I chose intervention radiology, because
Yeah.
when I teach my residents, the DNB residents in a hospital, when they develop a small interest in intervention radiology, I feel like so contentful. Like,
Wow.
okay, so when I do that, when I get that happiness, how much happiness people, mentors like you will be having, because we moved away from the hospital, we started our own setups, or we started developed a department.
Yeah.
So when my juniors, I have my loving juniors, when they do cases by themselves, I remember my olden days. That happiness once we finish that procedure, okay, I have done something good, something new to the
Yes.
patient, and always patient safety first. Even after we may be tired, we may be having a lot of issues, mental, physical, family, whatever it is, but once we see that patient's response, once we taste that essence of love and care from the patients, from their family, once they get healed off, it's a real secret essence. I don't know how to explain that. Yeah.
You explained it really well, and I mean, it's well understood actually, whatever you have said. So I think you get that contentment. It's very rewarding when you see, the love from the family of the patients. When you see that
True.
gratitude that they express, you feel that you have done that's
And
yeah,
that can be developed through the counseling part itself. When we see
yes,
them very first in the OPD,
yeah,
we used to spend so much of time with them, with their families, because nowadays, because of the busyness, doctors doesn't have much time to spend with the patients. They don't even look at the face. They'll be busy either typing in the computers or writing in the notes and send the patients and send the files. So when patients comes to us with that mentality, when we sit and give a small smile and ask them to come take your seat, and how are you doing, and what do you had for breakfast or lunch, when we give some small conversations on to them, they feel so relaxed.
correct,
I got a lot of testimonies by God's grace. Like, patients used to tell, like, "Sir, we have never seen people like you who speak to on our face,
yes,
smiling." Because when we talk to them, when we talk, they listen so carefully, they listen so lovingly. And when we counsel them, this may be the issue. You may be having cancer, but everything is treatable. That gives them so much of relief. So the counseling part is a major role in this intervention radiology. Plus, we'll be learning a lot of things from their clinical physicians' notes. We'll be discussing with the physicians. So all those things, when I learn from you and cope up everything, it's like building blocks. It will
yeah.
come to a very good, great picture,
Yeah,
beautiful picture.
absolutely. I'm so glad, you're talking about all of this, because as you rightly said, IR is a 360-degree thing, right?
Yeah.
So maybe one quadrant is your clinical skills, the other quadrant is, your skills with the clinicians, the other quadrant is your personal development, and the last quadrant is your patient skills, how you are with your patients, how you interact with your patients, how you make your patients feel
Yeah, true.
comfortable, how you counsel your patients. I think all these, only when it fits in, when the 360 degrees is complete, that is what makes you a fabulous interventional
Yeah,
radiologist
true.
like you are. So hats off to you for that, Jithu. And I think, and one more important thing that I learned is, we need to focus on our strengths and not on our weaknesses. And I think you're one person who are a hardcore example for this particular concept. You seem to focus on your strengths, and your bloody strength is, people skills, talking to patients really well and being nice to people. And one more skill that you have is feeding people with his culinary cooking skills. And it's the way to a man's heart is through stomach,
Yeah,
right?
yeah, yeah.
Even to a
True,
way
very
to a
true.
woman's heart is also through stomach. And so that's so I think it's amazing what you're doing. So just keep doing whatever you're doing, and you have been inspirational to a lot of people, I'm sure. And so to the youngsters and people who are going to finish IR or who wanting to take up IR, is there
Yeah.
anything that you would want to say or share? I know we've probably said a lot of things, but in 2 lines, if you want to say something. Yeah.
Yes, when those budding IRs, when they come to the world, real world, lot of good opportunities are waiting for you, because we have lot of opportunities in need of IR in most of the hospitals. Be passionate in what you do, and stay humble, calm, and enjoy your work. That's all I can say.
Lovely, lovely, lovely. I think you have said that in such a crisp way that people can absorb whatever you said just now. Nice and crisp 2 liners. But thank you so much, Jithu,
Thank you, ma'am. I'm
for being
humble.
here. I
Yeah.
know you've been extremely busy here. I can see that.
Yeah.
You're running a
Lot of
conference
calls
now.
coming up.
Yeah, you're running a conference, and despite that, you have taken the time to really participate with me in the podcast, and I'm deeply humbled by that.
Thank you, ma'am,
And
for giving me this opportunity in this beautiful place, and welcome to Kerala.
Yes, likewise, likewise. Thank you so much for that. And we look forward to meeting you again in another podcast.
Definitely.
Yeah. So thank you once again. Thank you for watching this.
Thank you.
Yeah.
Thank you so much.